Yeah, so I'm doing YouTube Live because that's the only one that I knew how to use, like that you could just like save it. And um, how many of you guys had me for intro? I feel like okay. At least did you do?
Yes.
Okay. So this class, as you saw in the syllabus, is um, it'll be similar to the intro class. Do you think we're 6 feet apart enough that we can like do like this or not? I just hate the volume on that, but I guess that tells you to show up in person for class. That would be better.
Yeah.
So this class has more. There's like 6 or 7 papers in the intro class, which is a lot. It's getting you used to writing for social work. This one we have more. We do the first one was like, it looks like a family tree, the genogram. If you have questions about it, that's okay. I know that the first round was to be turned in. Then there's also the eco map, which shows like where all your energy is spent throughout the day. And the reason we do those is because if you are working with a social work client, it tells you a lot about them learning their family history, like what history historically runs in your family with mental illness, what historically runs in your family. So just all the questions that can help give you a better idea of how to serve them. So if you're a social work practitioner, that and then knowing where all their day is spent, how many hours at work, how many hours at school, if they go to church, if they participate in the community, you can also get a picture of what's going on, if that makes sense. So just kind of in this class, we learn how to do it on ourselves first, and that then teaches us how to serve others with it next, if that makes sense. The other big presentations and papers in here are um, you'll pick one of the major mental illnesses to present on yourself. So if you're interested in alcoholism, if you're interested in any eating disorders, if you're interested in even the opioid epidemic, drug abuse and use, even how the economics have changed since we had the pandemic happen in March, which a lot of us are struggling. Things of that nature, like the big overreaching issues that affect all the families. After this week, I'll put up a sign-up sheet, and what you'll do is pick a date you want to present, and either, well, we only have 2 months now, either October or November. It's so crazy. And then you'll create a PowerPoint with like references on alcoholism or citations on the mental illnesses that you're going to present on, and then teach us about it essentially. So you get to teach for, say, it's between 9 and 15 minutes, like that. Because it's getting you ready for graduate school. I know this is more of a mid-level, 300 level class, but that's what they'll have you do a lot of in grad school for your MSW, which I would encourage all of you to do. It's so much easier if you get your BSWs. It's only 1 year for your MSW. So, and then the final paper will be very similar to what you presented. I tell a lot of people, if you want to like do both of them, if you want to teach the class on alcoholism and write your big like 8-page paper on alcoholism, that's okay with me. If you want to do it on homelessness and poverty, that's okay. Because in grad school you'll do the same research all the way through. Like if you have an interest in, my research was on refugee resettlement, like doing work with Burundian refugees and then Guatemalan refugees, and the food pantry at St. Leo's and things of that nature. So those are the big projects in this class. So I guess that's good. There's only 2 months left. If you guys all had me last year, you've already seen the self-care PowerPoint. Same things apply, but maybe even more is we got to stay healthy. We got to be, drink enough water, eat enough vegetables and all that. So I won't go through that and bore you to death with that today. I get to see my class live development as I have this 3-month-old baby, and we're trying to pop out a new one here. We don't know if it'll be like next year. I'm 42, so maybe I'm all dried up, but we'll find out. So it happens. Or I guess the oldest I've seen a woman have a baby is like 41 or 42 personally, but I've seen like the mega stars have those babies at 50,
Yeah.
right? Doesn't like Janet,
Janet
who had babies? Hey, welcome.
Yeah, it was Janet Jackson.
Okay, so we'll be going through like development. I know that I have had some of you last year, but I want to go ahead and introduce ourselves again, just so everybody knows who everybody is. My name is Dr. Trout. I practice social work now for 20 years. I was at Claremont Recovery Center for many years. Then I worked at Ohio Mentor, Lighthouse Youth Services. Started teaching. I began the doctoral program and started teaching at like University of Cincinnati and NKU. 3 years ago, I finished my dissertation and started teaching full-time and went to part-time practicing. So I work at a private practice now. I do hospice. Does anybody know what hospice is? Have you guys seen them? We have like 13 in Cincinnati. So they all do a big spectrum of services for folks that are passing. My grandma had them. And that's the cool part about getting your license is you can do almost anything with a social work license. When you get your master's, you really can do anything with it. I've been teaching here now. This is my third semester teaching, and I'm glad we're back in person. I don't like the online stuff, but it just seems like more work because everything's like electronic and whatnot. So if any of you guys want to introduce yourselves, go right ahead.
I'm JT. I'm from Chicago, Illinois. I'm a social work major.
Okay. Are you, what year are you now?
I'm a sophomore.
Awesome. So who'd you have your intro class with? Was it last year? Or have you taken it yet? I don't know.
No.
Okay, so this is your first social work class. Cool. Okay, well, welcome. Chicago is a close enough drive, isn't it? It's like 6 or 5.
Yeah, 5.
Cool. Anything fun happened there this summer?
No, I just work.
Yeah, that's good. That's probably, I tried to pick up, this is the first year, by the end of the year, I might have my 4th job. Because they cut our salaries a little bit. Anybody else affected by the pandemic, like layoffs or money or just that stimulus check finally came? How many of you all still were on your parents and they got it and you didn't get it? All of you? Damn, right? You're like, give me that money. Anyone else want to introduce next?
I'm Brian. I'm from Cleveland, Ohio. I'm a social work major. This is my sophomore year.
And you've already taken like,
Yeah, I took intro to social work and I took social welfare.
okay, so you're already,
Yeah, I took social work as well.
cool, okay, so you guys are already like 6 or 9 of your 30 hours done or something? Awesome. We're trying to get reaccredited too, which would be huge this year. Anybody else want to go next?
I'm Sydney Pendergrass. I'm from Columbus. This is my senior year.
Oh,
I just changed my major last year after fall semester, so I'll be here just a little bit longer.
okay. I did that. I was psychology major. Nobody told me to take social work, and I added a theology major the very last year, and it took an extra, like, for real, year and a half. I should have never done it, but I did it. I wish I was social work all the way through. Are you two want to go first or second?
My name is Bree. I'm from Dayton. I'm a social work major and I'm a sophomore.
Did you go to high school out there too?
Mm-hmm.
Which one? Is it like, which side is that on? I feel like I've heard of it. Because when I taught at Miami, I did like visits to all the social workers in Dayton and kind of saw what they did there. So.
No, I was an education major.
Okay. And so you switched?
Mm-hmm.
Cool. Well, welcome. You want to go?
My name is Sienna. I'm from Pittsburgh and I'm a sophomore.
How's Pittsburgh this summer?
It was alright.
Was it like as busy as like Cincinnati? We like baseball, we can't even go in person. I guess football this year we can go in person. Did you guys hear about that? Like any Steelers or Bengals fans here? No, that's fine. But I just found out this week, 6,000 lucky people get to go see the Bengals game. I bet you're paying a lot of money for that ticket. So, well, cool. Any questions about like the assignments that are due this week? That's gonna be the family tree and the way to, you have yourself and then your parents and then both sets of grandparents.
I have a
They-
question.
yeah.
With the eco map that's due today, it's basically like how to do it is basically in schools, we give out the instruction on how to do it and everything like that.
Yeah, there's a lot of YouTubes on how to do them, and there's even programs if you want to use them. But I think it's easier to draw by hand. It's like drawing. Well, we drew one last week in person, so like the two, you, then your mom and dad, then your 4 grandparents, and then any of their like your aunts and uncles, and then you're looking at if there's any. Well, the year they were born, the year they passed. If you're like all my grandparents have died, if they went to college. And if there is any deficits or assets, like alcoholism in the family, or ADHD, or a smoker. We say if they pass from cancer, like I had 3 grandparents die of cancer, or if they had a stroke. That way you get an idea of like the genetic background of yourself, and pass that on to working with clients when will you do field? Next year or next month? Or senior year or junior year?
You said, like when you go in the field?
Field practical, yep.
Oh, okay.
Senior year? Probably junior year.
You can do it junior year. A lot of people choose senior and you do like 400 hours out of agency. So some of you are coming up on that. And the cool part is that all counts for your graduate school. So if you get your master's in social work, that 400 some hours counts towards your 900 at grad school. So you only have to do 400 more at grad school. So that's a huge saving grace. Any other questions about the eco map, the genogram, or, a lot of our stuff, we won't meet in person Mondays. We'll just do like a discussion board and maybe video, just because it's a hybrid, like we'll meet in person, go online, meet in person, go online. And people seem to like that one the best because you get both worlds from it. So, hello, welcome.
Hello.
How are you?
Yeah, how you?
Good, good. We all just got done introducing ourselves, so if you want to be the last one to introduce yourself, that would be awesome.
Well, I'm Didi Yao. I'm from Cincinnati, and I major in social work.
And you're a sophomore, right?
Mm-hmm.
And you went to high school in Cincinnati. Okay, cool. And we went over kind of the eco map and the genogram. So if you have any questions on that, I'll cover it now. Those are like the stuff due this week to put up in Schoology.
So with the eco map, I was so confused on that.
It is confusing. That's why I always say, like, any questions, please tell me. Because I might even draw one again for you guys. Trying to see if the Reds are going to win a playoff team. Chalk. I feel like we always get chalk stolen. What was the question? Go ahead with that first.
So you're supposed to put your name in the middle and then put like family members or anything that you have a relationship with.
So yes, on the eco map, it's everything, like, think of it about what you do all day long. What do you do with your day? How much of it is school? How much is work? Do you go to church? Do you volunteer in the community? And like the good and bad energies, if you're at practicum. And it just kind of shows you how you spend your whole day plotting that.
So basically, we're just writing like our name and then just the stuff that we do out of every day.
That's the eco map,
And then,
yes.
so do we put like the time or we just do like?
You can make it as detailed as you want. I mean, some people get way into it. I've even started, actually, this is a better way to look at it. Have you ever downloaded this app? So, you guys ever hear that we get tracked our every move on our cell phone? Like everything that we do? So I went ahead and signed up for this app because I thought it was kind of cool. I was like, if they're gonna track me, I wanna know all the information they got. It's called Life Cycle. This, it does it based off location. So like today, this is the whole month. So if you go today, I actually slept 7 hours with a newborn baby. I don't know. My wife says she tries to let me sleep when I have to work, but I don't believe her. No, I'm just kidding. She does. And then it shows that I've been driving for an hour and 26 minutes today because I live in Cincinnati. I actually don't tell them where I live. I say that where I live is my work. So just because I don't like being tracked that much. Oh wait, this is today. It says I walked for 41 minutes and I was at work. I was at the private practice this morning, so for 6 hours. So that's kind of like an eco map. And this, it traces you all day. And I'm like, if it's going to freaking trace me, I want all the information. Then you can go to a week. I've slept 61 hours this week, and you can look at them all. For the month, I've slept 200 hours. And then for the year, I've slept 2,500 hours of sleep, I guess. And it kind of tells you like your balance, you know, what you could do better if you exercise. It says I was at my parents' house, my sister-in-law's church. That's funny. U.S. Post Office, because I started hustling on eBay when we got our pay cut. I was like, I gotta start selling some crap. So going to the post office all the time during the pandemic. Grocery stores, you know, like it tells you everything. So it just kind of gives you an idea, like how do I waste my time during the day, or how productive am I? And this one is called, it's free, it's called Life Cycle. So if any of you are interested, it just tracks you. They're already tracking you on your device anyway, I think. So that's the eco map. Now the genogram is a little bit more detailed. You may have to talk to a mom and a dad or a grandma and a grandpa just to get some of those facts, if that makes sense. So any other questions? Does that answer your question from the
So should I redo mine again? Because when I tried to look it up, it just showed me like people they was close with, and then like communities or something.
Yeah. I mean, that's kind of what these are covering, like your school community, your work community, your home community. I mean, you can add to it if you want. Did you type it or did you draw
I
it?
drew it out.
You drew it? That's fine. If you think of anything you want to add, just add to it. And you can also show if you have like a bad working relationship, like a job you're about to quit, you can draw like a squiggly line, like this job sucks, I'm going to quit it, but I need the money right now, so I'm not quitting. And then chirps, like good energy, maybe it's like flow, like a highlighter, but it's just showing like your good and bad energy throughout the day. Does that make sense if I would describe it that way?
Should it be like a big circle, how yours just was, or like how should it look?
That's what most of them do. If you want to get creative, you can do however you want. If you want to do it differently. That's probably how like the YouTube will show you how to do it. In fact, I don't remember.
Can you draw one? Or we ain't got no chalk.
We don't have chalk. I guess they cut that out of the budget with our salaries, but let me go check the next door. Next door has somebody else. I drew one next door too. Let me just,
What the
somebody wrote in there, please erase the blackboard after your class. Because there's actually a genogram in that one that I drew. And then I guess that's the history dude. But like, yeah, the eco map would be like me or you. And they do show, I know one of them shows like several, like family, community, federal government. I like them more where it's like, I've got work over here, you might have school. Sometimes there's church or a place that you volunteer. I'm trying to think, what else would you throw in throughout your day? Maybe even like,
relaxing, me time.
Yeah, like stuff that you do for self-care or going out on the weekends, you can put that there. So even if school is really stressful, sometimes I'll have like a squiggly line, like, man, this sucks, I just gotta get it done and get a good job. Work sucks too, but until I get school done, work's gonna suck. But church is like my saving grace, because I go to the community and they lift me up. Or when I volunteer, like with the homeless guys and feed them, it helps, remind me that like I'm one paycheck away from that or something like that, so you might have good energy, however you want to draw it. So, and then, yeah, some people put it into a big circle. And where
And
else?
that's the eco map, right?
That one's the eco map.
And then the genograph is like the family tree.
Exactly.
That's what I did.
Okay, that's fine. I made them 2 separate assignments just to make sure you eventually do them both.
Yes, I did.
Oh, yeah.
All family for real.
We'll show the people in this class here. It's on YouTube Live, so you can watch it. You're in the center, then you got schoolwork, church, volunteering. What else can you add? There's other things, but my mind is drawing a blank today. Nightlife, self-care, running, yoga, exercise,
Yeah, it's not.
dog, taking care of your dog or cat, something like that. So those are some of the ideas there. And then that one was due first because that's a little bit easier. And you can just snap a picture of it and then turn it into school with you that way. And we're learning these because you get the idea of what your client does all day, and then you can serve them better in the social work community. Like, what was I worked at a drug and alcohol place for many years. And sometimes just getting an idea, they don't have to draw it up, but they'd be like, yeah, dude, we just smoke all day long and like at night drink and stuff, like, so who's paying for it all, like kind of getting them just to talk about it without judgment. You're not judging them. You're not like, that's messed up, or, like just assessing and getting ideas of how they spend the day, what they do throughout the day. And sometimes you look at it and you're like, damn, I gotta do something different. I gotta add this into it or add that into it. So I've tried to give you guys all of the PowerPoints, so you should be able to download all the PowerPoints of the book. I might have even scanned the first chapter of the book, but so we're kind of creeping into chapter 3 and chapter 4 at this point. We did 3 last week. We were trying to find more baby pictures to show what is that? And we're going to go through every stage of development of life. So we did like the fun part last week, egg, sperm, fertilization, kind of the growth throughout the 9 months. Finished up with, I'll show you guys. There's your PowerPoint. Okay, so chapter 4, if it wants to download. Any questions about like pregnancy and the newborn? My wife just had our first baby in June, so we're all like excited because we're old as hell. I'm 42 and we gotta have another baby, and that's kind of, your fallopian tube, when you're fertilized, the egg latches on. You've got cell division right away, the embryo attaches, then for 12 months you're on the uterine wall. You can see the heartbeat like at 6 weeks. Then 90% formed, the embryo is most vulnerable. So like at our age, the miscarriage rate until week number 12 or 14 is very high. Then you go to the fetus, which is at about 8 weeks. And this is the other weird thing. 2 weeks is actually fertilization, because they count it from the last period. And we were saying that last class. So you have your period, you drop an egg. When you're fertilized, the day it's fertilized, that's week number 2 of the baby, which is weird, but that's why they go 40 weeks. While you could be in the womb for 40 weeks should be 10 months, but it's really 9.5 months. Does that make sense? So they always count from your last period. And you're not fertilized until 2 weeks later when you drop an egg. And 90% formed. Then you've got the fetus basically from 6 weeks after fertilization or week number 8 all the way up to 40. Most people have their baby at like 38 or 39 weeks. They actually call it early at 38 weeks, your full term at the 39th week, which is like 9 months and like a week or so. And yeah, because that would be 37. The placenta is kind of the thing that feeds the baby, you know, like you have a baby and then you have the placenta, so it's kind of weird. They had to cut the umbilical cord. And then the freaking placenta came out. Some people save the placenta and put it in pills or like scramble it with their eggs, which is kind of gross, but it gives you all the iron from the blood. It's like historical traditions that they do. We had to have the baby early because the amnion bag broke and she was like leaking. And there was enough in there, but not enough for the baby to stay safe. So they induced her. If we were in New York, we could have had an abortion at that point, but we chose to have the baby because it was what we wanted. Here's kind of the, there's the bag right here, or the placenta. So that's what feeds the baby. And then kind of, she was 6.5 pounds. So most babies are 5.5 to 9.5. She came, well, because the bag broke, they had her induced about 10 days early. So it was supposed to be June 23rd. Isabel came June 14th, right before Father's Day, and then I'm June 19th. So, and then there's ways like to judge if the baby is healthy from the very beginning, you know, and then they always tell you to take prenatals right away, like literally the moment you find out you're pregnant, they're like, pop the prenatals, take the omega-3, 6, 9s for like brain development, and like eat a lot of vegetables, eat a lot of fruits. Some sexually transmitted diseases can be transferred, mostly herpes. So if you got herpes, it's not the end of the world. They can do a C-section and avoid like a vaginal birth. That way the herpes doesn't get passed on to the baby. Herpes is passed all 4 ways. So that means herpes simplex 1 on your mouth can go to herpes simplex 2 on the genitals. So that's just something, even in, I just found that out in college. So it's important to know, like if you got a cold sore, don't be messing around. Drug use, they can test the baby's first poop and see how much poop is, 5 months of the baby's life is in that poop, because like the baby hasn't pooped yet. So I think the baby starts producing poop at like 3 months. So then 5 months of poop, it'll show like any drugs, alcohol, things of that nature. And if they find drugs or alcohol, that's when Child Protective Services could get involved. If they don't, you're okay. It does say drug use can cause addicted infants and have actively engaging environment use for alcohol is the easiest one to prevent. So there's fetal alcohol syndrome. They used to say you could have 1 or 2 drinks. Now they're saying don't even like touch it. Don't even like drink mouthwash or whatever because it's got alcohol. They can do an ultrasound. They can also do a sonogram. We're supposed to go in for one soon to see if she's pregnant again. So we're trying. You're supposed to wait like 3 months, 2 or 3 months, but because then the uterus has to heal, like it kind of like goes back, and then also the I'm blanking on what gets dilated, cervix. The cervix has to close all the way, because if you have a baby too soon and the uterus isn't shut and the cervix is still a little open, you can like drop the baby. So it's just something that you want to be cautious of. But we know people have had babies all the time. They're like 9 months apart, 10 months apart, and 11 months apart. And they're called Irish twins, I think. I don't know. You guys might know some Irish twins. I know one.
Yeah, my siblings, they was born, my sister, they're 9. And then, yeah, my brother. Before the twins turned 1.
Oh, that's an Irish triplets.
Yeah.
That's legit. That's how you get it done when you're like an old man like me. You're like, all right, I got to spread my seeds, so let's get this done fast. And she wants a lot of kids too. I mean, we both have talked about this. She's from a family of 7. I'm from a family of 5. So we're okay with 2, 3, 4, or 5. But and then everybody says, how you want to pay for them? I said, the government and God. They're looking at me crazy, but I just they know that I like to play. It all works out somehow. You really just need like bunk beds and crap, right? That's what you need. I had a bunk bed with my little brother. I'd throw up on him. You know, like when I got the flu, he was under me. I'd be like, ugh! It'd be all, yeah. And then you guys have bunk beds. My poor
My
little.
sister, they have my
Did they?
bed. Yeah, they have my
Hello. They just check to see if we're wearing our masks. I'm just kidding. I don't know, maybe. They have installed a lot more cameras. Have you guys noticed? Like, even the ones on the sports center that like move. Like, dang, they got surveillance everywhere. You could be premature. You could live outside the womb at 23 weeks, actually. Because we have such updated technology. I mean, you're a little dude. Have you seen some of these premature babies? They're like freaking tiny. But we got enough technology. Usually you can like get their lungs back up to par. So I know we went over these last time, but I did them on the last YouTube live, but I wanted to kind of cruise through them in case you guys had any questions on pre-birth stuff, and then we'll get into the infant stuff. Well, our baby does recognize my voice, so they say they start hearing you outside of the womb, from inside the womb, like at a young age. About 26 weeks, so that's like 2 or 3 months before they're born. This is probably the most groundbreaking research recently, is that mother's emotions can affect the fetus. So I do a lot of work on trauma-informed care and the research on trauma, and like if you are in they've done studies on like a war-torn country where babies are born during war, and if mom is scared all the time, her cortisol is spiked. And so the cortisol affects brain development of the baby. So it can cause depression, anxiety related to lower birth weight. Those are the other studies they've done. 10% of the time, they're spent in a quiet alert state. These are the psychological dimensions. They learn how to recognize when a baby has had enough, particularly in the NICU. Anybody know what the NICU is?
Is that like where they keep the babies?
Yeah, like the neonatal intensive care unit. So like if you're a preemie, you got to go inside them little tubes and stuff.
Like the ones that be at Walmart with the fake baby in there?
What's that?
They talking about the ones that be at Walmart with the fake baby in there?
I think I've seen those. What are those for? I forget.
They get us to try to get us to donate.
Oh, they're giving money. Okay, right. Yeah, so that's like neonatal. Now in Ohio, with the heroin epidemic, I don't know how it is in Pittsburgh or Chicago. We got a lot of like heroin and fentanyl, so we've had babies born kind of like, in the 80s there was a lot of crack babies. Now we have more fentanyl babies or like a heroin baby, and they have to wean them off of the drug. You know what I mean? Like they slowly, maybe they give them, I don't know what they give them, but the babies are shaken.
Yeah, that's what I told my cousin. He, when he came out, he was shaking, and they didn't think he was.
Right. Yeah, I mean, it can thing, it definitely can kill the baby. And it's hard to quit shooting dope.
Especially the natty. That's what they
If
like.
you're shooting dope, and they got, in Cincinnati, they started putting in the weed, man. So you start smoking, you got fentanyl in your weed, you're messed up. There was overdoses from that too. So it's like, what the heck? So the cops, we had a lot of internships at the homicide department. They would look into some of that, like, what the hell is going on? I was like, we're missing something here, aren't we? Okay. Is that still big enough for you guys? Okay. So newborn characteristics, they can focus on objects. I notice our baby always looks at freaking patterns. It's and like the ceiling fan, you just like stare at it. It's hilarious. So we can get her to laugh now. She's started talking a lot. We were showing some of the videos like right before. There she is. She's all crazy.
You a big girl? Tell me I think you are a big girl.
And she can go from like happy to like pissed off right away. Like,
Take your little toy.
F you guys. I think she gets pissed off.
She look mad.
She like went like right away, like, you're laughing at me, Mom? So, and it's been a shift because my wife was working full time. We decided to, she's done like 60 hours in school, so she kind of has an associate. She's trying to finish her bachelor's now online. And, it is, in the pandemic, it's been crazy. It's just been weird for all of us. So, oh yeah, the babies prefer contrasting complex patterns. Like they always look at like a pattern on your shirt. They're like, I don't even know why. Your eyes are just like attracted to it. They prefer high-pitched sounds like a female voice. They prefer sweet over salty. So a lot of those formulas are like corn syrup. Right? That's the first or second ingredient. It's milk and then corn syrup. So they drink all that. They don't like bitter. They don't like acidic. They can imitate facial expressions such as sticking out their tongue. It is pretty hilarious. And so if they're colicky, they define that as 3 hours of crying a day. So bouts of crying late in the afternoon and the evening. It's usually from 2 weeks to 4 months. It is often to do with digestion, like they get acid or reflux or they got a burp. So you just got to get the gas out, or you got to give them like probiotics to like help digest their milk. The rule of 3 diagnoses colic in otherwise healthy, well-nourished babies that crying occurs for more than 3 hours per day, for more than 3 days per week, and for more than 3 weeks. So that's how you diagnose colic. Like you're a social worker interviewing them. Organic causes of colic are less than 5%, like constipation, lactose intolerance, meningitis, or even abuse. So if the baby is being abused, it is going to cry, like they do sense pain. Primarily, the causes of colic are gastrointestinal, psychological, or neurodevelopmental. Oh yeah, that's why one of the discussions is that still life, the still face. Have you guys seen all those still face videos where mom like sits in front of the baby and shows no emotion, and the freaking baby flips out? And then the video I have for the discussion is the dad doing it, and the baby still flips out. So they've done this. Yeah, so it'll be in the discussion board for this week. And if you Google like the still face experiment, it's kind of sad. It's like if mom is shooting dope or even dad and they're like passed out and the baby wakes up and is looking at you and you're just like, it knows right away that you're not engaging. You're not like talking or communicating with your eyes. It knows right away. And it freaks out. So then it spikes the cortisol in its brain and then the brain development's off. Or if you're depressed and you just like can't, interact with your baby so well as you're suffering from depression and medication may or may not help. The baby knows it, like the baby can sense that, like we think, oh, they don't know crap until they're 2 years old. Like they respond to everything. I'll show you the mom still face. You guys might have seen this last year too. And it's just a video. I put the bad one in there, but here it is. This is like the famous one. I just wanted the video. I have no idea. Although, this is a good relationships website, the Gotham Institute. All right, if it'll play from here, I'll just do it.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 34 years ago, when people didn't think that infants could engage in social interaction. And the still face experiment what the mother did was she sits down and she's playing with her baby who's about a year of age. And she gives a greeting to the baby gives a greeting back to her. This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this. And then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it, they actually may lose control of their posture because of the stress that they're experiencing. It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happened, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
Or, like maybe tell them, like, shut the hell up. And that's probably not ugly. Instead of consoling them or whatever. And it might be because of like having just normal familial stress or some crap going on at home, or like trying to get something done. Like everybody's working from home now, and like just how we respond, like that energy kind of goes out into the world. So I wonder if they have other still face ADHD versus non-ADHD. So yeah, there's a bunch of those. I put up the one with the father is doing in utero. I'll watch it later, I promise, but that does look interesting.
Parents who are stressed have been shown.
I don't know if you could even do that. The baby can hear you in utero, and they definitely like hear and sense things. So I don't know. I'm wondering if they truly could like tell. They definitely can tell when there's stress or screaming or yelling, or like if mom has like stress hormones going through the body and the baby is affected by it. So I'll look it up and try to make something more of it next time. I don't want to take too much of your own class time. It does look interesting there, doesn't it? What's that?
Oh, 3 minutes.
This is the one that I usually go to next, because this is the most important that we actually do face in Cincinnati. So like in like the Midwest, we are the #1 sudden infant death syndrome birthplace of the United States of America. You guys ever heard of SIDS?
Mhm.
Because they're doing a big campaign on sudden infant death syndrome. So would you rather watch The Science of Neglect or this 3-minute one on in utero, the still face experiment? Okay, because it's 3 minutes. All right.
Not to be able to be as attuned to their infants and children as parents who are not stressed. Not their fault. Not because they don't love the child. Not
Addiction,
because they're
that
not
makes sense.
dedicated, devoted, committed. Simply because stress effect impedes their ability not to love their child, but to attune with their child. So that mutual responsiveness is interfered. And that has an impact on brain development. There's an important chemical called dopamine. Dopamine is essential for motivation and attention. And you take infant monkeys and you measure their dopamine levels in the front part of the brain, and you find it to be normal. Separated from the mothers, those dopamine levels have diminished. In other words, the child's brain chemistry is affected by the unavailability of the mother. And this is true even if the mother is physically there or emotionally absent.
Imagine two tuning forks, like in this very famous still face experiment. The mother is one tuning fork, and it starts vibrating. And the baby's tuning fork begins to vibrate in unison with hers. And when that happens, gradually its own prefrontal cortex gets tuned. So it becomes empathic. It begins to relate to the mother.
Infants don't understand words. So they respond to body language. So is my mother rigid or relaxed? Is she afraid? Because if she's afraid, I am, because she's my protector. If she's afraid, who's going to protect me? The size of the mother's pupils, the mother's voice. Is it confident and relaxed, or is it tense? These aren't conscious thoughts, but this is the infant's experience.
Depressed mothers, or even worse, schizophrenic mothers, they are not in synchrony. The baby is getting the message that there's something wrong with it. Its prefrontal cortex is not going to be tuned properly. So that baby is going to develop a kind of depressive personality.
I'm here. And what are you doing? Oh, yes. Oh.
The monkeys tell us more about the severe effects of infant deprivation. The ones that were reared in isolation just don't behave normally when they're finally given a playmate. They rarely touch, and when they do, the contact's surprisingly vicious.
Children who are emotionally inhibited will become dysfunctional adults. They will have difficulty learning and will be more hostile. And that starts right in the womb.
Oh, I guess it's all movie. I didn't realize that. Huh. So yeah, we'll get into this one as we get to the older kids, because that's a big one. But any questions about that or observations? What do you guys think about, being in tune with mom and dad and having developmental possibilities? Because we all go through hard times, and like our parents go through hard times, so that comes out on us too.
I think that still applies. Like, when you're older now. Like, 'cause I know sometimes, like, if my mom gets upset or she gets sad, I get sad.
Mm-hmm.
So it's like, you can still feel that off of your parents. So I feel like that reaction is just built in you all the way from, like, when you were a baby all the way to, like,
Mm-hmm. Yeah. Yeah, for sure. There's a lot of research on the trauma, and now that trauma can be experienced at a very young age, and obviously now they're showing trauma can be experienced even in utero, like as young as 6 weeks, or like whenever you get a heartbeat or get like the blood flow through your system. Because if you get that hormone of stress, the stress hormone cortisol, that's what it runs through the bloodstream of the mom, is going to run through the bloodstream of the baby. It's like if heroin's running through the bloodstream of the mom, the heroin's running through the bloodstream of the baby, or alcohol, or whatever it may be. So, big heroin epidemic in Ohio and some of the folks that are challenged by it.
So is it some, sorry, I can't think of whose theory it was, but one of the phases is like trust versus mistrust. Like I can't think of the theory it was, but it's
Piaget.
yeah, I
Yeah,
think it was.
or
And
Erickson.
it's one of them.
Yeah.
And like that's like the first stage is like trust versus mistrust. So like the child's like crying and stuff, and the parent doesn't give it attention and try to figure out what's wrong. Like that's when the child, like even as an infant, will learn like, okay, this isn't like right. Like they
Right.
learn not to really trust you. So
Yep.
then like when they grow up, that's like how they start feeling towards other people, like not trusting. So that just reminded me of that.
Yeah, it's definitely, and a lot of times with a baby, it's something simple. The diaper's wet, they got poop, they're hungry, or they're tired. It's not always all of those, but like if it's colic and indigestion, that's another one. But like they'll tell you when they feel off. And you know, if you meet their needs and then they learn to trust you to meet their needs, they cry, it's okay if they cry, but you meet their needs, they stop crying, they begin to trust, and it does kind of like flow into the future for sure. I can see that. So, this doesn't sound much different than adults. Infants use sleep to control the environment. Like when you're stressed out, some people like to sleep to avoid, it's easier to dream than to do homework or something, but infants do it too. So they have the several states of the newborn. You also have the newborn reflexes. Like a newborn, if you tickle their cheek, they're thinking that you're holding them for breastfeeding, so they'll turn their head and feed. Just go like this, and they'll go like that, and they're like, all right, it's time to eat. And then, yeah, they learn how to walk and crawl, and then I forget what some of these are. But if you throw them in there, they will show you exactly what it is.
Is that like when they be trying to like grip stuff?
Yeah, and a lot of times when it's like, yeah, that's it.
I knew it.
I was gonna say, one of them is when they're falling, and that was from like, maybe it's this one. The doll's eyes are kind of creepy.
What's that? I was just about to ask you what that was.
Yeah, I'll show you. It's kind of fun to mess with the baby with that because they'll like basically follow you no matter what. You ever seen those creepy dolls that are like they open when you lift it up, and they close when you lay it down? Like Chucky. Maybe I should have just gone into the description. So typically the doll's eyes reflex is elicited by turning the head of an unconscious patient while observing the eyes. The eyes will normally move as if the patient is fixating on a stationary object. There's a negative doll's eye reflex, and the eyes remain stationary with respect to the head. I know that probably made it more confusing, but like, you ever seen like, sometimes there's the doll's eyes too, where like they turn, they're always looking at you, so there's a few others. Like the
What was the one you was looking at, the Bobby?
Babinski, that one's a like when they're like when we were more primates and we could grab with our foot, if you tickle the foot, they like kind of grasp, if that makes sense. Or like spread out.
When you pay extra for a turbocharged engine,
commercial.
you might feel the need to show off. What if it comes standard? You might not. Click, call, or come by your Volkswagen dealer today and lease the sporty, driver-inspired 2020 Jetta S for just $129 a month.
In this video, I'm going to demonstrate the Babinski sign, which is used in neurological screening. Hi, welcome back to PhysioTumors. The Babinski sign has a reported sensitivity of 51% and specificity of 99% in the detection of an upper motor neuron lesion, as reported in a study by Yaramir et al. In year 2014. To test for the Babinski
So these are big words you don't have to remember, but knowing the reflex, even the kids still have it.
sign, run a pointed object from the heel along the lateral aspect of the foot forwards towards the great toe. In a normal human being, it will result in a flexor reflex.
It went
or
out.
resting of the
No, it
toes.
did.
The Babinski sign or reflex is a pathological
Did it go right
reflex
before he
and is
did?
characterized by extension of the big toe and abduction of the other toes, which is also called the fan sign or signe de l'éventé. In severe cases, the Babinski sign may be accompanied by hip and knee flexion. A positive Babinski sign indicates disturbance of the pyramidal system, either from structural damage or temporary disturbance due to epilepsy or intoxication.
So yeah, you know how they test all your reflexes when you go into the doctor? They even did it on mine recently. They were seeing if I had a knee kick.
Yeah, I don't. But I know like with babies, if you like press your thumb down on like the top of their foot, like right there at the top where like the toes are at, their toes will go like this.
That's right, yeah. I should say, this is what I should have searched, because that was more in adults, but here you go. This is 15 seconds. So you're right, it's like they grab on those too. And that's how they check if your brain is connected to all of that and you have the normal reflexes. Like the knee is a big one. They still, I think we all should have that. They hit you like right. Yeah, there it is. And then
Testing the Babinski reflex in infants.
have you
The
tried it?
Babinski
Yeah,
reflex
that's
can be
exactly
tested in
what it is.
infants by firmly stroking the sole of the foot with a finger or a blunt object along the lateral side from the heel to the toes. Typically in infants, a tonic dorsiflexion of the big toe as well as a plantar flexion and spreading of the small toes occur together. This is known as the Babinski sign and is physiologically present in infants until between 12 and 24 months of age. Afterwards, the sign may indicate damage to the corticospinal tract.
So there you go. You don't have to remember all those words, luckily, in this class. You can if you want to, but the test usually has more, like it'll ask different stuff related to, so yeah, getting into the strengths and hazards. Right when you're born, you want mom to hold the baby's skin on skin. That's the golden hour. Which one of you said you get charged for it by the hospital?
$40 you gotta pay.
That is messed up. I don't know if that's like
You have
them
to pay for that?
observing.
Yeah, you gotta
That's what
pay.
she said. They like itemize it in your bill. Like either they observe, tell you to do it, or show you how to do it. And they're probably charge you for it. Like
Yeah, if you look it up, it'll say like, I forgot what it said, but they charge you for holding your baby when you're born.
that does sound like some 1984 type of crap. So there's good bacteria. You don't want to wash the baby. You want to hold her and she gets used to, again, the energy and like the interaction. And they had me hold her and she had the stamps on her feet. So I had the baby stamps on my chest. It was hilarious. So I'm holding the baby. She still has her stamp. She's got some big old feet. Because my side of the family, like my sisters and mothers all have like 9s, 10s, and 11s. And I don't know.
they pain.
What's that?
I feel they pain.
Right, yeah, they get pissed too. They're like, I gotta buy heels. And I'm like, just freaking buy them.
It's stressful. Outside.
But this baby will not fit. She's 3 months and she won't fit into the 6 to 9 months, mostly because of the feet. So we can't buy her the ones with the preset feet because like her foot's all like this. So yeah, you inherit the genetics of your family, like all the good and the bad. So healthy babies. So, this is a social work program. that when you have a newborn, especially if it was born early, Help Me Grow. Has anybody ever heard of the program called Help Me Grow? So as a social worker, you get out and teach mom and parents and kids how to interact and like the healthy interaction so they have normal development, how to eat, how to stay healthy. This, again, if you guys are from any city in the Midwest, go ahead and look this up. This is huge, and for some reason, it's very high in the US. I think it's because we're freaking distracted all the time. So like, you're doing something and we got 5 other things going in the other room, or your electronics, or like, you know, whatever it is, and the freaking baby rolls over, and like, that's why they say that to prevent this, the baby has to sleep alone on their back in the crib. And so it's the hbse, alone back crib. If you do that, they're not going to roll over to a pillow and then freaking suffocate. So the mortality, especially in the Midwest, and also higher for Black and Hispanic infants. The primary reason for death among white infants was congenital abnormalities. For African Americans, low birth weight. And what contributes to these differences, and when I had this class last semester, we were trying to look up, because there's a lot of, Cincinnati's like literally the epicenter of this. So we've had a huge campaign to advertise about this, like infant death syndrome in Cincinnati. It's pretty bad. And so, let's do Cincinnati and then ABC. And they're just trying to prevent the, in Hamilton County, 96 babies died before their first birthday in Hamilton last year. 3 more than in 2018, when the county reached an all-time low. So 10,000 births, and the mortality was 9.1 deaths per. And so they had a few videos. Have you guys seen any of the billboards too? Like ABC, that's about COVID. Have we had any more cases on campus? Anybody know?
They never even announced how many people like had it.
Really?
Not to us, at least.
Right. We get tested like every week at my hospice job, so they definitely stick that needle up our nose like every week. Infant mortality and ABC movement. So basically, alone back in crib. That's like what to remember. How to reduce infant mortality, and maybe they're done. Like they got all the federal funding for the ABC movement, and it's over with.
I remember seeing commercials.
Yeah.
Yeah, I haven't seen any commercials in a long time.
So it looks like we've gotten a little bit better in the past couple of years, but it's something still to kind of like look out for. Some social risk factors, so poverty, mainly because we don't get access to food as well. If you're a social worker, you want to direct the moms to WIC program. I think that's Women's, Infants, and Children. So they get like the cheese and the milk and like all the proteins that they need for healthy development. As poverty, if you're not getting the nutrition, it affects all of the development. Also domestic violence, so 1 in 4 women are abused during pregnancy. There's increases of miscarriage and low birth weight and preterm labor. So there's a lot more fights. You know, I don't know, maybe like the mom or the dad is anxious about having the baby in general, and they're fighting about that, and they both hit each other, or how, you know, so it's something to like watch out for. It does step up a little bit. And I wanted to get into this one, but we might cover more of it for the next period, so dipping into chapter 4, but this is infancy. So again, getting into high infant mortality, historically the main developmental task in infancy was survival. So like keeping the baby alive and keeping them, you know, way back when though, I feel like they had really high infant mortality. Now we have a lot of shots that prevent like antibiotics and things of that nature to help you live. The rates decreased drastically with improved nutrition and control of infections and disease. So like taking your prenatal vitamin and having a sanitary birth instead of like birthing the baby out in the field like we used to. Having the baby, in the middle of a hospital is a little bit cleaner, just a little. I don't know, maybe it's dirtier with COVID, but I don't know. They tested my wife for COVID. Is if you do have it when you have the baby, like go into the COVID when you have the baby. And then increased recognition in the early 60s of the consequences of poor early child development. So that's when we got federal government funding for a lot of social work jobs called the Head Start program and the Help Me Grow program. So we started getting a lot of these. Early Head Start was in '95, and then probably Help Me Grow. This is kind of the history of how everything went through with policies and how we started getting daycare. Now you can write the daycare off on your taxes. Daycare is freaking expensive. Did you guys see that? So that's partly why we decided. My wife was working full time, and it was like a lot of money just to send the kid to freaking daycare. So.
Yeah. It's important that if you're able to get a voucher, to get the voucher.
Right. How much does that even cover though? I mean, will it cover all of it, or is it?
No, you still have to, like my friend, she got a voucher for my mom daycare. And so all she has to pay is like $60.
Okay. Every week?
Every 2 weeks.
Okay, so it's like $120 a month, which is still like $1,440 a year or something like that.
That's a lot. My uncle, he paid like, it was $600 a week for one kid.
Right, yeah. So do you want to work and pay that, or do you stay home and, it worked out that we, like get help on tuition and then student loans. I already maxed out mine, but my wife is taking some. So she's watching the baby and taking like 6 or 9 hours if she can. So, and you guys probably know a lot of moms that are doing that. They're like, you got a baby and you're taking school classes. Mm-hmm. It's hard, but it's not impossible. What's that? Really? It's hard, right? It's like, so any questions about any of this stuff, or like the assignments or discussion boards? I can't believe it's already October.
Ready to go home.
In Russia? Yeah, when's fall break? Do we even have a fall break?
No, when we leave for Thanksgiving.
Yeah, that's
it.
our fall break.
So everything goes online. Okay.
November 24th, we all went on until spring.
Yeah. That is definitely different. What about study abroad or going overseas or anything like that?
I think it's over with.
Yeah, that's over with.
Or remember when we started talking about COVID last year, were you guys in the class? I know. I was like, there's this thing that they identified in China, and it might be coming here. People would be like, whatever, dude, like conspiracy theories, and it's weird that it showed up the way that it did. I just don't, Last year I went to India with a social work program at Miami University, and 2 years ago I went to Rome, Italy. I don't think you can do any of that stuff anymore. There's no way. Like, they're done. The economy, I don't know. It's just, I'm a little worried about the economy. I'm not going to lie.
I'm gonna need to go back to normal. I'm tired of, I forgot my mask.
I know. Yeah, I know. I have so many like laying around. I'm tired of it smelling like spit when I put it back on. Oh my God, why does it stink like this? My breath that bad? I guess it's good that I'm not breathing on people, but that's what a teacher toothpick is for. Man. Well, cool. We'll take Monday online for you guys and see you back on like Wednesday.
All right.
Send any questions you got. Even if you're late on the assignment, go ahead and do it. That's all you do. No matter what, just get it done. We'll get you through this.
Thank you.
Thank you.
Hi, Jesse. How are you? Chilling. Tomorrow,